are arthritis, heart disease, and osteoporosis. Now, we spend 75% of our total health care costs on chronic illnesses. That's a big, big number. And I bet it affects everyone in this room because it's what's driving health care costs to go up. In this country, we treat chronic diseases reactively, the same way that we treat acute illnesses. If you fall and you break your leg, we treat it. We give you a cast and you get better. With chronic diseases, we wait till you get it, even if we know that you're developing it as you're sitting here. And then we treat it. And that is philosophically incorrect. And that's part of the reason why our costs are going up and up. Does everybody understand that? So let me ask you a question now. In comparison to the nutritional illnesses that we were talking about, scurvy and beriberi, would it have been better, for example, for Dr. Lind to have waited for his crewmen's teeth to be falling out and their gums to be bleeding and them having poor wound healing and dying before he gave them a huge vitamin C injection? Or would it have been better for him to do something every day? Does anybody know which would be better?
Better to work on it.
Do something every day.
Do something every day. Absolutely. And that's another important nutritional truth. If your illness has a nutritional component, and most chronic illnesses do, it's far better to do something daily than it is to wait until you've got a full-blown illness. It is much harder to get better. And as I'm going to explain to you, that is part of the reason why our healthcare costs are astronomical. In order to explain this further, I'm going to talk to you a little bit about our bones. I know that's why everybody's here today. So this is a picture of two bones. Our bones develop inside of our bodies, obviously, from the vitamins and minerals in our foods. And they develop over time through young adulthood, into adulthood, until about the age of 25. And when you turn 25, you undergo a process called ossification, and that's hardening of your bones. After ossification, yearly, your bones begin to demineralize and weaken. That's the chronic nature of osteoporosis. When, after years and years, your bones demineralize and weaken, they become porous. The name osteoporosis actually means porous bone. Can everybody see the difference between these two bones? This one is healthy, and look at the porosity of this bone. This one's ready to go. Osteoporosis threatens public health. Here's some facts about osteoporosis. It affects almost 50 million Americans. Actually, 44 million Americans are affected by osteoporosis. There are generally no symptoms, and for those people in this country over the age of 50, which is most of you, 50% of men and 50% of women and 25% of men will have a fracture related to osteoporosis in their lifetime. Now this is pretty scary, but of those that have a fracture, almost 25% will die within 1 year of that fracture. And 50% of the people that have a fracture related to osteoporosis won't be able to walk across the room unaided. Ever again. The U.S. treatment costs amount to almost $19 billion. Now that's a big number. The majority of this is for the treatment of hip fractures. And that's the thing that bothers me. And that's part of the thing, that's part of the reason why I'm here and what I'm trying to express to you today. $13 billion out of that $19 billion is spent on fixing the fracture. Okay? So that's almost 70% of all the money that we spend on this chronic disease goes to fixing a fracture after it occurs. What does that do to strengthen your bone? What does it do to make you healthier? Nothing. Not one thing. There's not a dime spent on prevention. Not a dime spent on trying to strengthen your body at that point. We spend all our money trying to fix something that's been building inside of our bodies throughout our lives. Now, this is simply inefficient. By waiting to treat an illness, it raises the cost. Why? Because we don't have options. When you procrastinate in life about anything, do your options go up or down? Down. So, doctors don't really have a choice. At least they don't think they have a choice. And what happens to the cost? The cost of treating an illness goes way up. And so does the risk. The risk of treatment for osteoporosis is very high. Now, every time I talk about risks of care for osteoporosis, I always talk about the Women's Health Initiative. Now, the Women's Health Initiative was established by the National Institute of Health in 1990. And it addressed the most common causes of death, disability, and poor quality of life of our older women in this country.